students, without wasting the time, let's start the CSF. It is a modified tissue fluid. It is colorless, odorless, and found in the ventricles of the brain. Subarachnoid space is the space between the arachnoid, that is the second layer, and the pyometer, that is the inner layer of the brain or the spinal cord. So it is found in the subarachnoidal space of the brain and spinal cord. It is about 150 ml, formed at the rate of 20 ml per hour. It is formed in the choroid plexus. Plexus is a collection of nerves. And it is found in the choroid plexus of lateral ventricles. It is also formed by the capillaries on the surface of the brain and the spinal cord. CSF is circulated how? CSF is formed in the lateral ventricles. Then from the lateral ventricles it goes into the third ventricle by the interventricular foramen, that is also called the foramen of Monro. And from the third ventricle it goes into the fourth ventricle by the cerebral aqueduct or the aqueduct of Sylvius. Then from the fourth ventricle, some of the cerebrospinal fluid passes to the central canal of the spinal cord, and some of the cerebrospinal fluid passes through the subarachnoid space of the cerebrum. How it is absorbed? It is absorbed by the arachnoid villi. It is also absorbed by the perineural lymphatics around the first, second, eighth cranial nerves. Function of the CSF: it acts as a shock absorber. It nourishes the nervous tissue. It provides glucose and oxygen to the neurons. It also protects the clinical anatomy is lumbar puncture, that is the CSF is obtained from the lumbar puncture. Yellowish discoloration of the CSF, that is Froin syndrome. Hydrocephalus, in which the head of the person gets dilated. Obstruction of the CSF circulation, that may be communicating or non-communicating. Communicating if the obstruction of the CSF occurs outside the ventricles, but if it occurs within the ventricles, then it may be non-communicating hydrocephalus. If you found the video helpful, please do like, share and subscribe. Thanks for watching.